Hello and welcome to Trapezius. We are now on page 68 and 69 in your book. It's a big muscle and it covers 2 pages. So the trapezius is actually named for its shape. It looks like a trapezoid, or a kite shape is a trapezoid. Sometimes muscles are named for their location, sometimes they're named for their actions, sometimes they're named for their shapes. This one happens to be named for its shape. Also, in case you were wondering, this information is in your book down at the bottom. It'll tell you the name, it'll tell you the pronunciation, and then it will tell you whether it comes from Greek or Latin. And I know I told you this before, but remember to take a look at those at the bottom to know how to pronounce them, and also just in case you're curious about the etiology of these words. All right, so trapezius is the most superficial muscle of the upper back, but it's very, very thin. It's like this. So when we palpate trapezius, it's very difficult to feel the actual fibers of it. Unlike deltoid that we just did, which you can feel all in here, it's pretty bulky. Trapezius is not like that. It's thin and it's flat. So it's going to be hard to palpate on yourself. We'll try, but we'll mostly be palpating these by action in class. So we're going to feel what the muscle does on each other. All right, so let's get started with the origin and the insertion. Here we are. All right, so trapezius is all of this. You can't see me pointing. All of this, have to use the cursor. All right, trapezius, like deltoid, has different fiber directions. So here we have the upper trapezius. See, upper fibers, upper traps, middle traps, and you see those fibers are in a completely different direction. They go horizontal. And then we have the lower traps. So we're going to be dividing the actions that way. All right, ooh, there we go. We can see the whole thing. So lower traps go all the way down the spine to T12 here. So it's not, it looks like a huge muscle. And as far as, I guess, real estate on the back, it does take up quite a bit. However, like I said, it's very thin and very flat. So it is not a big, bulky muscle. All right, so let's talk about the origins and the insertion. Multiple ones of trapezius. So the origins really start all the way up at the base of the skull. They come down the neck and into the thoracic spine, right along the midline of the body. Now, these are called spinous processes. We haven't really talked about the spine yet. We'll get there. Spinous processes are those things that you can feel in your back when you bend forward. They stick out a little bit, right? Those are the spinous processes. And if I turn my skeleton around, you can see the spinous processes stick out posteriorly. So when it says spinous processes, that's what it's talking about, the things that stick out posteriorly on the spine, okay? The insertion is over here on the scapula and the clavicle. So let's take a look at the actual origin and insertion. All right, here we are. We're going to have to do the origin and the insertion before we do the actions. And you can see there are quite a few actions. They take up all that. Okay, so the origins of trapezius are extensive. I will read them and then I will explain this. We have the external occipital protuberance, the medial portion of the superior nuchal line of the occiput, the ligamentum nuchae, and the spinous processes of C7 through T12. Ooh, that's a mouthful. Okay, so we really have 4 origins of trapezius. And if you are listing them, make sure you have 4 bullets. If you're a visual learner, bullets really help. Okay, so that's the origin. The insertion is the lateral 1/3 of the clavicle, the acromion, and the spine of the scapula. Where have we heard that before? Yes, that is the origin of deltoid. You will notice when we put these muscles together that trapezius and deltoid actually have similar attachment. So let's go ahead and get into, come on, there we go. Our muscle premium here. I do want to show you, oops, I just want to go back in there. Oh, dearie, dearie, dearie. Let's just go back here. Okay. So here we are, right? So all of this is trapezius, as you can see. And here is the insertion. So lateral 1/3 of the clavicle, acromion, spine of the scapula for trapezius, right? And for deltoid, we had lateral 1/3 of the acromion, or lateral 1/3 of the clavicle, excuse me, acromion, and spine of the scapula. You see, they have the same attachment. Now, they're not in the exact same spot, certainly not, but this is still the clavicle. This is still the lateral 1/3 of the clavicle, so they have a similar attachment. So we can see it from a couple of different angles here. I like this view. Here's deltoid. And of course, here is trapezius insertion. Okay, that should be easy to remember if you study these 2 muscles together because they have a similar point of attachment. Now, let's make him a little smaller. Oh my goodness, he's pretty small here. And I'm going to take trapezius and I'm going to fade him out, okay? Because I want to talk about the attachment points for the origin. So right here, let me make that bigger and then whoa, Nelly. It's very responsive. Hold on. I guess I can't do that because my computer's in the way. That's okay. I'll make them small again. That's fine. Okay, so right here, see those little bumps here and here? Those little bumps are called the external occipital protuberance, EOP for short, which is, we shorten it because external occipital protuberance is a mouthful. These are the bumps. Well, it's actually a single bump on most people. It's at the back of your skull, right here. It's about halfway down, okay? Right at the back of your skull. And some people have really large EOPs and they're really prominent. And some people have really teeny tiny EOPs, not as prominent, but they're all, every one of you, single one of you has one, whether it's large or small. And that is the first attachment point for trapezius, the external occipital protuberance. Okay, right there. EOP, it's in the middle. Now, and you know, again, this is just showing you little attachment areas. Occiput. Okay. Now, I actually want to get into the skull. So I'm going to go back into, I don't want to do the shoulder region. So I'm going to back out and just go back into our book because I think I can show you from here. All right. Let's go back a page. Here we are. This is a little more detailed. Okay, so right here, this little thing right there is the EOP. Okay, right there, external occipital protuberance, that little thingy. I get to draw. Okay, so here's the EOP right there. E O P, external occipital protuberance. So that's attachment number 1 for the origin. Attachment number 2 is actually right here. See these little lines? They kind of go like this, and okay. That is the medial portion of the superior nuchal line. Medial portion of the superior nuchal line is just kind of like this, okay? The nuchal lines themselves are just attachment points on the occiput that make a bit of a ridge, and they're very, very faint and very tiny, and you can't feel them. And actually, if I had a skull that could stay together, my skull doesn't stay, then I could show you in color where they would be. We'll talk about that in class. But anyway, this is the medial portion, because it's closer to the midline, of the superior nuchal line. Now the word nuchal, N-U-C-H-A-L, means neck. So that's next. Right here, let me show you that. Right here, you have a spinous process that goes like this. It is forked, okay? And this one, and you can really see it here, right there. That one right there, you can see is very forked. So it's like this. There is a ligament that runs down in the middle of those forks. So it runs straight down through here, like this. It attaches to the middle there in those forks. So it's very convenient, okay? That is the that is the nuchal ligament. In your book, it says ligamentum nuchae. It's the same thing, okay? It's the nuchal ligament. And remember, nuchal means neck. So we're talking about a ligament that extends off the posterior neck like this, okay? It's actually a fin-like ligament. So it's not thick, but it's wide, okay? So it extends off the back of the neck like that. That is another muscle attachment for trapezius, okay? So right now we have the EOP, medial portion of the superior nuchal line, and ligamentum nuchae. So that's 3 of them. Then we have the spinous processes. So here we start the spinous processes. Just color them in here. Spinous processes of C7 through T12. C7 means cervical vertebrae 7. So let me clear all my drawings here. So we have 1, 2, 3, 4, 5, 6, 7. Right there. That's the 7th cervical vertebrae. How easy was that? Okay. And then if we start here, this is thoracic vertebrae number 1, or T1. So we're going all the way from C7, cervical vertebrae number 7, all the way down to thoracic, starts with a T, thoracic vertebrae number 12. Okay, so that's what C7 to T12 means. All of this attachment right here is spinous processes of C7 to T12. All right, so that's what we have for origins of trapezius. We have the EOP. We have the medial portion of the superior nuchal line of the occiput. We have the ligamentum nuchae, and we have spinous processes of C7 to T12. So the more you say it, the easier it'll be. Now, the insertion, we already know. It is the lateral 1/3 of the clavicle, the acromion, and the spine of the scapula. Yes, okay, so let's go into the actions. Now that we know the attachment points, Let's talk about the actions. Well, first and foremost, we have upper fibers, middle fibers, and lower fibers. We already talked about this. But within the upper fibers, we actually have two very separate types of actions. We have bilateral action and unilateral action. The thing about trapezius is that it attaches on both sides of the posterior neck. So if both sides of those fibers contract at the same time, that is a bilateral action. And in this case, they're going to extend the head and neck. Okay, you can see, that's actually not a very good picture at all, but you could see that if both fibers contracted at the same time, both sides, they're going to pull the head and neck into extension. That's a bilateral action. Unilateral action, on the other hand, is if just one side of upper traps contracts. And because it attaches to the midline of the body, because it attaches along the ligamentum nuchae there, we can have rotation and we can have lateral flexion, okay? So let's start with those. Unilaterally, so just one side, we can laterally flex the head and neck. So just one side here is contracting, like that. Okay, so it says laterally flex the head and neck to the same side. That is annoying to me because you can't laterally flex to the opposite side. Go ahead, try it. I'll wait. Can you laterally flex to the opposite side? No, you always go to the same side that you're flexing, always. It's redundant. So lateral flexion is fine. Laterally flex. Okay, now rotation of the head and neck to the opposite side. Ooh, this is where things get a little confusing. If this side of the upper traps contracts, so this is my right side, it rotates the head to the left. Do you see? So if this side contracts, it rotates the head and neck to the opposite side. And this is called contralateral, rotation. Contralateral rotation. Rotation to the opposite side. You may use either term. You may use rotation of the head and neck to the opposite side, or you may use contralateral rotation. You need to know both, okay? Rotation to the opposite side is contralateral rotation, which I believe was in that penguin prof video. We talked about contralateral and ipsilateral. Ipsilateral would be rotation to the same side. Okay. So laterally flex and contralateral rotation. Now remember, upper traps has an attachment on the scapula. I mean, all the trapezius muscles attached to the scapula, you know that. But because we can have unilateral action of just upper traps, we can actually do things to the scapula too, okay? So we have elevation of the scapula, just like that. Okay, so upper traps, remember the origin is along the midline, so we're pulling the scapula towards, let's say, the EOP or towards the skull. Okay, so the contraction goes like this. Try to loop, loop, like that. So elevation of the scapula, just like that. Upward rotation of the scapula is a little bit different. In upward rotation of the scapula, remember that the glenoid has to point towards the ceiling. That's upward rotation of the scapula. It looks like this. So if I start to raise my arm with deltoid, right? I start to abduct my arm with deltoid. Once deltoid gets to about 90 degrees, then upper traps takes over. Watch my upper traps. See them contract there? They've got shorter. That is upwardly rotating. So whenever you raise your hand up in the air, like you're asking a question in class, that is upward rotation of the scapula, okay? It doesn't occur in a vacuum. Like when you're upwardly rotating the scapula, your arm is typically doing something as well, okay? Upward rotation. Let's take a look at these. Come on. There we go. All right, so I'm going to go to T for trapezius. And the computer is slowing down a little. All the muscles, transverse abdominis. There we are, there's trapezius. Okay, awesome. So elevation of the scapula, upward rotation here, that's what I want to show you. Because you can visualize elevation, you do it all the time. There it is, there's upward rotation. You see how the arm is also moving. Although trapezius does not affect the shoulder joint, pardon me, at all. Let's move this around so you can see. That's upward rotation. See how the glenoid ends up pointing towards the ceiling. Right, there it goes. Upward rotation. Excellent. Let's do a little bit of bilateral action because we've only been talking about the unilateral actions here. There it is. See, upper traps right here. See them contract at the same time. Both sides contract at the same time and you get head and neck extension. Okay. All right. Awesome. Love it. Okay, now as far as contralateral rotation is concerned, they do not have it listed with traps. They'll have it listed with some of the other neck muscles. So I'm going to stay on traps for a little bit, and then maybe I'll show you the other ones, or maybe I won't. Maybe I'll save it for class. Okay, so let's go into middle fibers. So middle fibers go straight across, so they go transverse, right? And if you go back here, you can see, I guess I was in that. Yeah. The transverse fibers go straight across. These right here. Okay. So the actions for middle traps are pulling things towards the midline, right? Because the origin is the midline, the insertion is the lateral 1/3 of the clavicle, the acromion, and the spine and scapula. So you have to pull that towards the midline. So the action really is adduction of the scapula. Adduction of the scapula, remember, is when the scapulas go toward the midline. Scapula. So it's kind of like when you stick out your chest, your scapulas move toward the midline of the body. They also help stabilize the scapula. And you'll see this sometimes. Stabilization is an action. Stabilization is important when you are doing other actions. So the scapula has to stay where it is while you do, other things. That's what stabilizing means, okay? And if we go back into muscle premium here, that's exactly what this is doing. Scapular adduction. See? Sorry, I don't mean to move this around so much. I don't know why they brought the arm up for that, but whatever. You can see the fibers moving towards the spinous processes, right? The insertion is moving toward the origin. And that's how this works. All right, and then the lower fibers. So the lower fibers actually make a pretty severe angle from T12 up towards the spine of the scapula. So they're almost vertical, but not quite. And because of that, they have two different actions. They can pull the scapula down into depression. So your scapula is head towards the floor. That's depression of the scapula. But they can also upwardly rotate the scapula. And I know that sounds a little weird because you think, well, they're below it. How could they upwardly rotate it? Let me show you. Okay, let's go back into upward rotation. All right, so I'm going to hide serratus anterior here for a second. These fibers right here pull on the very medial edge of the spine of the scapula right here. So they're not pulling all the way out here, they're pulling from right here. So it's going to pull that part down. See, when they contract, they pull this part in that direction. It's like a horizontal direction kind of, which tilts the whole scapula. If you're pulling down from here, it goes like that and tilts the whole scapula into upward rotation. So I'm trying to show you, like, visualize that, or get you to visualize that a little bit, because that's one of the more confusing ones, I think, to visualize. But it's pulling this down like that, okay, into upward rotation. And then depression, of course, is just pulling the scapulas straight down towards the feet, okay? All right, so you have all of the information for trapezius. To recap, origin is the external occipital protuberance, medial portion of the superior nuchal line, nuchal ligament, and spinous processes of C7 to T12. The insertion is the lateral 1/3 of the clavicle, acromion, and spine of the scapula. And the actions are too numerous to say right now. Make sure that you compartmentalize this information when you're studying it. Study the upper fiber actions, study the middle fiber actions, study the lower fiber actions. It'll help you to remember it ultimately, okay? And be sure to study trapezius with deltoid because they have a similar attachment point. All right, next up is latissimus dorsi and then teres major, or teres minor, excuse me. All right, I'll see you soon.